Prior to beginning the activity, please be sure to review the faculty information and disclosure statements, as well as the learning objectives. After listening to the activity, complete the post-test by clicking the Earn Credit link in the episode description. Downloadable slides and resources are also available. The following presentation is copyrighted by Medscape. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of Medscape.
Off-label therapies have not been approved for the use specified in this activity. This information should not be considered as a recommendation for the use of a drug outside of the recommendations in the currently approved prescribing information. It is the policy of Medscape Education to avoid the mention of brand names or specific manufacturers in accredited educational activities. However, trade and manufacturer names in this activity are provided in an effort to provide clarity. The use of brand or manufacturer names should not be viewed as an endorsement by Medscape of any specific product or manufacturer.
The following presentation is part of a certified educational activity provided by Medscape Education and supported by an independent educational grant from Madrigal Pharmaceuticals.
And how are you feeling today?
I'm well. Honestly, I'm a bit worried. Dr. Thompson mentioned liver disease, but she also said my liver enzymes were normal, so I really don't understand what's happening.
I understand. Can we go through your history together?
Sure.
First, has anyone in your family had issues with iron levels or liver problems?
No, not that I know of. I don't recall any liver issues.
Well, that's good to know. Now, you mentioned fatigue. Are you experiencing any abdominal pain, particularly in your right upper abdomen where your liver is?
No pain there at all. I do get some nausea after eating sometimes, though.
I see. That's probably unrelated to liver issues. But do you have any other symptoms, like yellowing of your eyes or skin, swelling in your legs?
No, nothing like that.
Okay. Do you know about how long you've had diabetes and high blood pressure?
I started blood pressure medicine around 35 after my last child was born, and diabetes about 10 years now. I'm on metformin and that weekly injection, the GLP medicine.
Okay, and do you recall your most recent A1C level?
It was 8%. I know it should be lower, but it has come down since I started the injection.
Well, that's good to know. Would you mind telling me about your weight history?
I've always struggled with my weight. Sometimes I can lose some weight with certain diets, but I just can't keep it off. The injection is helping, though. I've lost about 5 kilograms over the last year.
Okay, thank you for sharing that. I would also like to ask about alcohol use. Do you drink alcohol?
I honestly don't drink at all. That's what's confusing me. Why would I have liver disease if I don't drink?
That's an excellent question. Steatosis, or fatty liver, can be caused by alcohol use, but it's actually commonly caused by the metabolic conditions you have, like diabetes, abnormal lipids, and being overweight. This is sometimes referred to as non-alcoholic fatty liver disease.
Oh, so diabetes caused this?
Diabetes, along with the other conditions you have, put you at risk for steatosis.
How common is this? Is it serious?
Steatosis is actually very common. About 1 in 3 adults has some degree of fatty liver, and most are unaware. The good news is it's reversible with proper management.
Oh, that's good to hear.
However, we do need to assess whether this has progressed beyond steatosis. Sometimes steatosis and inflammation can cause scarring in the liver called fibrosis, and that's what we need to check for next.
Fibrosis. That sounds serious.
It can be serious, but fibrosis can also be reversible. That's why we're being proactive. The next step is to assess whether you have any fibrosis so we can start treatment early if needed.
Hi, welcome here. My name is Laurent Castera. I'm a professor of hepatology at the University of Paris and in Beaujon Hospital in France. So the patient you just have seen has MASLD, and she also has several risk factors for advanced fibrosis. Hence, screening with a FIB4 is the next step here. Actually, screening is recommended in individuals with type 2 diabetes or abdominal obesity with at least one cardiometabolic risk factor or persistently elevated liver enzyme. So what is MASH, previously known as NASH? This is the active form of MASLD characterized by histological feature of inflammation and hepatocyte suffering, better known as ballooning. MASLD is widely prevalent worldwide. Around 30% of the are the most common liver disease. Prevalence of MASH is around 5%. In people with MASH, they are at risk of developing scars, known as fibrosis, and to develop cirrhosis. Once you have cirrhosis, you're at risk of developing complications such as decompensation or hepatocellular carcinoma. Fibrosis, but not NASH, kill the patients, is the key predictor of liver outcome. And fibrosis go from F0 normal liver to F4, but the risks start to increase at fibrosis stage 2. Fibrosis is a silent killer. Most chronic liver disease are asymptomatic, including with normal liver tests, and you may have cirrhosis despite the presence of normal liver tests. Okay, so now let's return to the clinic and see what happened next.
So, how do we check for fibrosis?
Let me start by calculating something called a FIB4 score using today's lab results. This gives us initial assessment of fibrosis risk. Since your primary care physician took your bloods last month, your liver enzymes are now mildly elevated. So, I'm using your age, 55, your platelet count of 155, and the liver enzyme levels AST 42 and ALT 45. Your FIB4 score comes to 2.22.
What does that mean?
Well, this score is interpreted in ranges. Your score is above this, which means we need a more specific test to get a clearer picture.
What kind of test?
The good news is there's lots of options. We used to have to do a biopsy, but now there's blood tests and imaging we can do. We call these non-invasive tests, or NITs for short.
Well, that's a relief. How will this other test help again?
The test uses a probe on your abdomen to take some measurements from your liver, a bit like an ultrasound. The results will help us understand if you have fibrosis and to what degree. If we find minimal fibrosis, we'll focus on preventing progression. If there's more significant fibrosis, we'll need more aggressive management to stop and potentially reverse the fibrosis.
I see.
And remember, catching liver disease early, especially fibrosis, allows us to treat it effectively and prevent progression to more serious complications like liver cirrhosis.
Cirrhosis? Is there anything we can do right now? I just don't want to get that.
We'll make you an appointment soon for the testing. And while we wait for the results, I'd like you to make some simple lifestyle changes. Diet and exercise are really the cornerstone of treating fatty liver disease.
I've tried dieting so many times, and going to a gym is just so hard to fit in with my work schedule.
I understand completely. That's why I would like to refer you to our dietitian who specializes in liver disease. She can help create an eating plan that fits your needs. And for exercise, let's start simple. Can you commit to 15 minutes of either walking or using an exercise bike most days?
15 minutes? Maybe that's doable.
Exactly. Just 15 minutes, either on a bike or walking. This is very achievable and will make a real difference for your liver and overall health.
Okay, I can work towards that.
At your next visit, we'll review your results and determine the best path forward.
Okay. Thank you for explaining everything. And I'll try to walk at least 15 minutes every day.
Okay, so the way to go is to use non-invasive tests, better known as NITs. Like what is done for colorectal cancer screening, starting with a FIT test, simple test, and then the colonoscopy. You have two categories of NITs, blood tests, and the most used one are FIB4 and ELF tests. You have imaging technique or elastography, and the most popular one is VCTE. When you're using NITs, it's important to take into account the context of use, cost, and availability. So at the first test, you're going to use a very simple, widely available, cheap test with a high negative predictive value, such as a FIB4. FIB4 is age, transaminase, and platelet count. Then, according to the cutoff, so if you're below 1.3, the likelihood of having advanced fibrosis is very low, it's less than 5%. If you're above 1.3, you need a second test that is more specific, and the one who qualify is VCTE or ELF or MRE. And the most widely used is VCTE. If VCTE is below 8 kilopascal, advanced fibrosis is highly unlikely. On the other hand, if VCTE is above 12 kilopascal, advanced fibrosis is highly likely. So this is the way to go. Now, the good news is we have 6 international guidelines aligned from the liver, gastro, endocrinology on both sides of the Atlantic. Now, let's go back to the patient case.
Good morning, Claire. How have you been feeling since our last visit?
Much better, actually. I've met with a dietitian and I've been making some healthier meals. I also have been walking 15 minutes most mornings and sometimes a longer walk on my lunch break too.
That's excellent to hear. Those lifestyle changes are really important. I'm glad to see you're taking them seriously.
I'm trying.
I have your test results and I'd like to go through them with you.
Okay, I'm ready.
We stage fibrosis from F0, which is no fibrosis, to F4, which is cirrhosis. Your test shows a reading of 14 kilopascals, which indicates F3 fibrosis.
F3? Wow, that's higher than I thought it would be.
It is significant. F3 is the stage before cirrhosis. However, the important thing is that you're not at cirrhosis yet, and F3 fibrosis is very treatable. You're actually a good candidate for treatment that can improve fibrosis.
Why is my liver this bad when my liver tests were always normal before?
That's a great observation. This is important because we can't be falsely reassured by normal liver enzymes, but you can have liver disease even when they're normal, like we saw initially. Your most recent labs actually show that your liver enzymes are elevated now.
I see. I still don't understand how I got fibrosis.
Well, when you have long-standing metabolic conditions like diabetes, you are at risk for steatosis. Over time, this leads to inflammation and scarring, which is the fibrosis we're seeing now.
And what about my healthy changes? I'm down another 2 kilograms. Won't that help?
Those lifestyle changes are still very important and will indirectly benefit your liver. But with F3 fibrosis, we can't rely on lifestyle changes alone and need to add a drug to address the fibrosis before it progresses.
I see. So how do we treat it?
At the moment, there's only one drug approved in Europe, but others may become available. These have been shown to improve the liver fibrosis and inflammation in patients like you.
Are there side effects?
Well, the option we have available for you is generally well tolerated. The most common side effects are mild gastrointestinal issues like diarrhea, which can be easily managed if needed.
Okay. And what about my other medicines? Will they interact?
Your current medications should not interact.
Okay.
Let me explain a bit more, and we'll decide together whether to go ahead with this. Then I can see you back in 3 months to reassess how you're doing and repeat your liver enzyme labs.
Okay, so now let's move to the management and treatment in clinical practice. Lifestyle modifications are the cornerstone of treatment. They include diet and exercise. So, patients who are able to lose 7 to 10% of their initial weight will achieve NASH resolution and improvement in fibrosis in a significant number of cases. However, the downside of it is that less than 10% of patients in practice are able to achieve these goals. This is the reason for which pharmacological treatment have been developed. Now we have 2 pharmacological treatments that have shown positive result in phase 3 study for patients with F2, F3 MASH. The first one is resmetirom. It's a THR-beta receptor agonist that is given orally at 2 dosage, 80 milligram and 100 milligram. The second one is a GLP-1 receptor agonist, semaglutide, that is given at a dosage of 2.4 milligram once a week injectable. Resmetirom has been approved in the US and is now approved in Europe. Semaglutide has been recently approved in the US, but not in Europe. So for the time being, the one you can use is resmetirom as it's approved. And the important thing is that the label comes without a liver biopsy, and the NIT will be used to select patients for treatment. So let me remind you, F2, F3 patients. And among the different NIT, VCTE is currently the most widely used. So in conclusion, MASLD is now becoming the most common cause of liver disease. Patients at risk should be screened systematically, especially for fibrosis, and the way to go is using NIT, FIB4 followed by VCTE. Patients with F2, F3 fibrosis, according to NIT, should be offered the pharmacological treatment that are now becoming available. Thank you for participating in this activity. Please continue on to answer the questions that follow and complete the evaluation.